The normal heartbeat produces two distinct sounds, S1 and S2, often described as loop dub. S1, the loop sound, occurs when the mitral and tricuspid valves close at the start of ventricular contraction. It's a low-pitched, dull sound, best heard at the heart's apex. S2, the dub sound, happens when the aortic and pulmonary valves close as the heart relaxes. It's sharper and higher pitched than S1, loudest at the base of the heart. In a healthy adult at rest, the rhythm repeats about 60 to 100 times per minute.